I really focus in on two things. One is finding the best talent on the planet, and two is driving culture. I hate to use the word hold somebody accountable, but how am I going to drive accountability if the goalposts are moving constantly and they don't really know, the employees really don't know what to do? What we came up with in terms of our internal mantra of how we wanted to lead, it was in this order: people, purpose, and then performance.
This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guest is someone I'm excited to introduce you all to and learn from. He's a sought-after leader at the intersection of clinical excellence, medical device strategy, and large-scale healthcare operations. He's an innovator who is reshaping the future of eye care through the power of AI and connected technology. He's a passionate advocate for charitable vision care, having dedicated time to One Sight and Eyes of Hope clinics, bringing sight to underserved communities throughout the world. He's also vice chair of the Illinois Eye Institute and vice president of professional affairs at Topcon Healthcare. I want you to please welcome Dr. Rupe Hansra. Rupe, welcome.
Hi, thanks, Ankit. Super glad to be here, and thanks for that wonderful introduction.
Well, I'm super excited to talk about your background, and I want to give the audience a little flavor for how you think. So with that, what is the most important thing that helped you grow your empire? What was your root cause of success there?
Well, the root cause of success really for me is the common thread really is around change. So if you want to drive scalable change, I think it has to be rooted into a purpose. And for me, that was driving quality of care, enhancing the patient experience, and then enabling sustainable practice growth. So all three need to be working in sync. So I kind of look at it as a three-legged stool.
Yeah. So let's talk about where and how that helped you in your career. So tell us a little bit about your background, because right now you're doing a couple of exciting things with Topcon, with the university. But tell us how you got to this situation.
Yeah, I've been very lucky. I've had a lot of great mentors, and it's been a very, very interesting career. Actually, I started out, I'll go even way back. I was actually admitted to the 7-year dent program at Marquette University. And I decided that really wasn't for me. And I just love the concept of optometry, being able to not only see patients, but see families, and then really understanding this link between your eyes and your overall health. I found to be quite intriguing. Practiced, between Chicago and California for about 10 years. And I went over in a leadership role back when it was just Luxottica. So I ran the Bay Area, San Francisco, had a territory from Minneapolis to Corpus Christi, did some things and strategy and operations for North America for Luxottica, had a stint at Grand Vision, and was lucky enough to go to VisionWorks for about 6 years. And finally, part of my agreement with VisionWorks was to be able to get into a PC or something like a joint venture with them that I scaled 20 locations.
Yeah. So you've got, we talk about different ways people build empires, and yours is a unique path. All right. You said, did I catch that right? 7-year dental school program?
Yeah, it was an accelerated 7-year dental program. So they admit you as a freshman and undergrad, and then you're automatically admitted after 3 years if you keep up a grade point average.
Oh, that's it. And then, so you went to optometry and you worked in corporate and worked in different areas, kind of worked your way up. And eventually you were in charge of 20 stores for VisionWorks. Is that right?
Yeah. So those are my practices. So, in terms of being able to have multi-unit, that is my specialty. So, anywhere between, 500 to 360 locations, depending on the position that I had across the country. But these 20 locations, we actually scaled. I think I inherited one, and 19 were de novo that we actually opened up in Seattle and then California.
That's amazing. And de novo is a cold start, basically, right?
That's exactly right. Yeah.
Just in case, I didn't know. I had to look up that term the first time you told me. So when you talk about your root causes of success, your things that made you successful, how did that how'd that work out when you were growing to your 20 practices? Like, tell us like some stories of why that was effective when you had to make tough trade-offs and to follow your thesis. Like, tell us about that a little bit.
Yeah, and so I think that, I believe that there's really two markers for success. I try to keep it very, very simple because, when you have one location, you're on site, you can control a lot of things. And you go to two locations, you're there 50% of the time. Three locations, you're lucky if you're there 30% of the time, and then so on and so forth. So I think if you want to drive execution, you have to keep things simple. And so for me, I really focus in on two things. One is finding the best talent on the planet, and two is driving culture. So when it comes to talent, it's a terrible book, but it has got great principles. So it's like a 400-page book called Top Grading. And what they talk about in top grading is finding the top 10% of talent within that salary range for that particular position. So I was very relentless in terms of finding the right talent for the positions that I was trying to fill. And then when I'm hiring, Ankit, I'm looking for uh, people that would fill certain competencies. So the number one competency I'm looking for is alignment to my vision. Then I'm looking for drives for results, looking for emotional intelligence. And then depending on the position, usually if it's a managerial position, I'm looking for critical thinking skills. And then finally, the ability to manage talent. So that's on the talent side. And then on the culture side, I really try to focus in on driving through results with and through people, purpose, and performance. So once again, um, if it if what we're doing doesn't deliver enhanced quality of care, doesn't deliver great patient experience, or isn't about growing the practice, then I would really question the motivation of, are we doing the right thing?
I love that. And we've implemented top grading too. It's robust. It's like 50 different categories. The interviews are like 3 hours long, but man, they're amazing. Those interviews were amazing to find out things about people you never would have known otherwise and patterns that you recognize. There is another book by his son. I think Jeff Smart wrote Top Grading. Brad Smart, his son, wrote Who, which is a little bit lighter version of that.
I'm glad you know the book because not very many people know the book. So I actually am going to write that down, as a matter of fact.
Yeah, Who by Brad Smart is a simpler version of top grading that probably gets you 80% of the way there. And you said it yourself, right? Basically, you're looking for people who are drivers, players who also make sense of the situation you would make a sense of it and can hold accountable. And so instead of measuring on all 50 dimensions, you would just say, like, give me the 3 or 4 that really are good, and let's look for that. But let's talk about that a little bit. So culture, if it's easy to look back, and some people might say, well, yeah, that's great if I had 20 locations. When you had 1, 2 locations, how do you implement that? Right. Cause then you're just worried about, okay, do I have enough patience? How do I build this? Dealing with like different problems at that scale.
You're exactly right. I mean, you have to start somewhere. And I think what culture allows you to do, and starting small is actually perfect. You don't want to start big because it's hard to change culture when you inherit something. If you're building something from the ground up, you know, you are the one that is setting the tone for the culture. And the way I look at culture is, culture is designed to create self-directed behavior. Because if I have to script out for you each and every single behavior and what to do in this situation, and I've been part of organizations where we've had people come in from the outside and they want to draw up all these scenarios and they get bigger and bigger, and this is how you answer the phone and this is how you greet a patient. But then again, it's so much to memorize. There's 100 things that you need to execute. But if I told you these are the three things that I need you to focus in on, that I want you to benchmark or measure yourself against, and this is what I'm going to coach to, I'm only going to coach to three things. I'm not going to coach to all this. I think then you create this concept of self-directed behavior. And as you coach the leaders, it's the leaders that create the culture. And then you create this sustainable growth as the leaders create the culture, and then the culture then creates further leaders, allowing you then to fill positions and then expand as you want to go to 1, 2, or 3 locations. But yes, it's really scary when you want to open up de novo. You got a loan on your head. Where do you hire from? It's a new market. I don't know any doctors here. It is a grind. It is a grind.
It's funny because what we look at now are something similar. Like we have our routing tasks, which are like your basic day in, day out jobs. Then we have our sense making. Do you understand the problem the same way I see it? And accountability, are you going to take ownership of it? And then the last thing for people managers is, can you build capacity in other people to do sense making and accountability? So it sounds like you had a similar philosophy.
Yeah, it's exactly right. And it's funny that many of us, we may call it different things, but it's very, very simple. And so, generally when I'm looking at talent, and we see it in a lot of the books, they simplify it into will or it's skill. If I was to take that as a pie, I would put it as will, skill, culture, accountability, and then capability would circle that, or enablement, to your point. So when it comes time to, I would say, what do you control as a leader? Can you control the type of talent that you hire? But if you want to scale a business, the capabilities or enablement, the systems that you put in place aren't really driven by the employee. That's driven by you and your vision. So when results happen, I kind of look for those things: will, skill, culture, accountability. But then there's a DNA component where I have to look in the mirror and I say, what is my DNA on this? Is it the
Mm.
systems that are in place? Is it the business model? Is it the capabilities that are there as well? And am I coaching and to the level that I need to be coaching to? Am I setting standards to the level that I need to be setting standards to? Because how am I going to hold somebody? And I hate to use the word hold somebody accountable, but how am I going to drive accountability if if the goalposts are moving constantly and they don't really know, the employees really don't know what to do?
Yeah, I think that's great insight and finding someone that works with your working style too.
Absolutely.
So as you were growing your practices, what did you run into that you didn't expect? Like, what was it surprising? Like, man, this was not what I expected. It was harder than I expected. Something like that. What was a challenge?
Give you a little bit of backstory. Many years ago when I was a young OD, I had the pleasure of writing a few articles for Optometric Management magazine. And Jim Thomas, who was the chief editor back then, I said, Jim, what are ODs interested in? And that really hasn't changed. He said, staffing, staffing, and staffing. So, you go out, you recruit, you find the best staff, you onboard them, things are starting to hum, you got your people in place. And then the next thing you know, somebody says, hey, I found another job, or I'm moving out of state, or I'm getting married. And so they want to switch, and then you're starting all over again. And that, I think we saw a lot of that during COVID. I mean, during COVID, finding employees was at a premium, and you put an ad out in the paper, for example, or online, and people are ready to come in. You set the time and they don't even show up for an interview, or they show up, you're ready to get hired and they don't show up for the first day of work. It was just an incredible time. And there was, the competition, not only for staffing, but for doctors during that time was at a premium. And so I think staffing is always unexpected, and you really have to have some thick skin. And, it's a choice. It's a personal choice whether somebody wants to work with you. And you have to be able to respect that. And you have to be able to create an environment that people actually want to work with you as well. But that staff turnover is always the hardest thing for me.
Yeah, it's funny. It's always even. I can't tell you how many times I know that lesson, and I still have turnover, and I still hurt by it every time. Like, oh man, I can't believe that. And I know it's going to happen. It's just natural order of things, right? But yeah, it's never easy. It seems like it always seems a little personal for me, at least.
It does feel very, very personal. And, again, when I was a younger OD, I had a situation where I wanted to leave. And my supervisor was an OD. He's somebody that I aspired to back in Chicago, Mark Jacob. And I wanted to move to California. And Mark was, Rupe, I'm sad to see you go, but at the same time, I'm really happy for you because I want you to chase what's out there and explore what else is out there. And so, that was a really good lesson to me, because it's for a guy who's got a lot of drive and who's competitive. That's really not intuitive to my thinking. It's something that, through mentorship, you have to be able to shape that thought. And I use that as an example for when doctors want to leave. My goal is is when I hire folks, I try to develop them. So I have a quarterly development program. So maybe we start with situational leadership, we go into fierce conversations, but every quarter, we have it's almost like getting an executive MBA. We got a core group of doctors. Um, we have a focus. Typically there's a book or some leadership principles. We tie that back to what's actually happening in the practice, the behaviors that we want to change, and then tie that to a measurable result. And so they go through this probably for about 6 quarters. I think that's where I feel very, very comfortable that they really understand the philosophy that I'm trying to build, but we're actually building leaders. So when they just say, you know what, I feel like I've hit a ceiling with you, Rupe. Like, what else is there for me? I'd like to I'd like to get a piece of the action. I like to do a role that you're doing. Or by the way, there's a private practice that is down the street that I used to work at, and they're selling. And the, what the most satisfying thing for me now is to say, go ahead, spread your wings, fly away. But when they come back a year and a half later, and they said, Dr. Hansra, we doubled the optical the first year I got it. That has happened to me, I can tell you, more than a half a dozen times. And that to me makes me feel really, really great that like this is what it should be about. Like I picked the right person. This person is self-motivated, they're driven, and they're sustaining this concept or this philosophy. And so I couldn't be more happy for their success.
And I love how your focus to scale is the people first versus I think a lot of times we think like, am I offering the right things? Do I have the right equipment? Those are all baseline things you need. But your path for growth was all around people focus and system focus secondary with people first.
Yeah, and I think, thinking about these 20 locations that I had a great business partner, Sam Campos, based out of Sacramento. And what we came up with in terms of our internal mantra of how we wanted to lead, it was in this order: people, purpose, and then performance. Well, we can pull up Power BI and take a look at what the results are. I mean, you've got a business degree. I always say doctors are scientists. It's not very difficult for us to go into Power BI, pull up the results from yesterday, and do an analysis of that. And so generally what ends up happening is we start focusing on the end result as opposed to start to work with the people. And so often when you pick up the phone and you call the office, and I say, Nicole, how are you doing? And she goes immediately to the results. Well, yesterday we only had 7 exams, and this is what happened. And the question wasn't what were the results yesterday. The question is, how are you doing? And so, it took a long time because we've sort of ingrained people to start thinking this way, that your value is only as good as the results that you deliver. That you as a person don't really count. And so we really focused in on people celebrations. So generally every office visit, every conference call that we had, we generally did a large conference call, usually on a Tuesday or Wednesday morning. We always started off with people celebrations. And that could have been somebody got married, somebody went on vacation. We put their pictures up there. Someone had a baby, but we always started with people celebrations, and then we went into the purpose. And the purpose is, it was a lot of storytelling. So it wasn't about what was your retinal imaging percentage, but let's talk about, was there any great stories from last week? And you would be surprised. People don't feel comfortable sharing the stories where they saved somebody's life. They detected, could be something as simple as background diabetic retinopathy, but this patient wasn't even aware that they were diabetic. And now what we can do is we can get them to their internist, get them on a sugar pill, diet, exercise, GLP-1 agonist, whatever it might be. But we're sharing these stories. And even the busiest times where, what insurance week is like, that week 51, week 52, benefits are running out. And we're just saying, oh, we got to take all these patients. Well, guess what happened? I can remember Dr. Singh's location in Tequila. She had a 19-year-old kid came in there. And turns out he had some raw spots in the back of his eyes. And sent him out to the emergency room. He was completely unaware of it, saved this patient's life. And then when she shared that, all of a sudden, a bunch of different doctors started to share with you. Well, I saw this week, and it did become about Insurance Week. We never lost our mission or our vision of what we're trying to achieve. So it's people, purpose, and then performance. Because I think if you do those two things, again, you get that self-directed behavior, and all of a sudden, you create a great experience. Patients do want to come back. And at the end of that exam, when they say, Dr. Patel, I just have one question for you. Well, what's that? You know, can you be my doctor next year as well? I mean, when doctors tell me that's how some of their exams are ending, like you know that you're doing the right thing as a leader and you're creating the right culture.
That's amazing. That sounds like a really fun place to work, actually. Um, so why the transition? I mean, you could have stayed and do that. What was the genesis and the drive to change?
First of all, let me share. I love my experience. Absolutely love my experience at all the companies I've worked with, particularly at VisionWorks and VSP. They were very, very kind to me. I love the mission and purpose of those organizations, the leadership there. When you start to grow and you get in this cadence and this rhythm, we were doing very, very well. And prior to my taking on these locations when I was in strategy and operations at VisionWorks, I had Alita Freshy and Chris Lee from Topcon Healthcare give me a ring, and they said, you guys have 200 OCTs. What are you doing with all of the data? And I said, I don't know, like, but let's go ahead and talk about it. In my mind, I'm thinking, yeah, we have a lot of patient data, CRM, demographic data. And Ali, who's now the CEO of Topcon Healthcare, said, no. Like, I want to talk about building a real world database. And I said, well, what do you mean by that? Well, with all these retinal images through AI and big data, we can take your image and compare it to a million other eyes, 4 million other eyes, and we can draw out these healthcare insights, both systemic as well as ocular. But in order to build these AI algorithms, we need lots and lots of data sets. And so proud to say, and thankfully, VisionWorks and VSP were very, very kind about that. And, we were the first to sign a data sharing agreement. Since then, I know many others have, including the Illinois Eye Institute, and I know, and others. Moorfields Hospital has a data set that they're contributing along with the NHS on, with some biobanks there. But I think for us, again, it was like this whole new world of oculomics. And, we've always known there's a link between your overall health and your eye. And I stated that earlier. I can even remember Scott Jens, my first day at ICO. And Scott Jens, who was a fourth year, was talking about, what are you going to see in clinic? You're going to see diabetes, you're going to see high blood pressure, and you're going to be diagnosing patients that have glaucoma. So it wasn't just contact lenses and eyeglasses. There's a systemic component, an ocular component that is out there. But now imagine a world where you go in, and most of us are taking retinal images as a wellness screener. But what if we're able to run an AI model in 30 to 60 seconds, come out with these healthcare insights? That's what Ali was talking to me about. And so when my time in strategy and operations were up, and I started to open up these practices, I did a little bit of consulting with Topcon Healthcare and Ali. And the more I delved into it, this is really going to change the entire healthcare system, and it's going to be fantastic for eye care, both on the ophthalmology as well as on the optometry side. Because who has all these images and all this data? It's not ophthalmology. Ophthalmology has all the sick eyes, and they don't want to see the low level cases. But who has all the data and is the entry point into this entire healthcare system? That's optometry. It's not general medicine or primary care physicians. Patients don't typically want to go see them, but I turned 40. Oh, I'm seeing blurry. I'm out of contact lenses. My glasses are scratched or they're broken. I got to go see my eye doctor. So patients are much, much more likely to go to your office or to come to my office than they are to go see their general physician. And so optometry is the perfect place to be what I'm hearing this word of being the front door of the entire healthcare system.
Yeah, I think it makes sense because the retina cells pick up on disease changes usually faster. And I'm not a doctor, but that's my understanding of being in the industry long enough that it's literally a window into your health, right? And so it can be pretty exciting. I've heard of really interesting things like heart health, other like kidney risk, diabetes, obviously, but all these other things that are coming out with OCT scans that might have correlation and causation linkages based off of scans that you can pick up earlier.
Yeah, and there's different ways that we can do that, and you're exactly right. And so probably in terms of like what are the big costs on the entire healthcare system right now? Americans, we continue to get sicker and sicker. 1 out of 6 Americans has some type of chronic disease. 1 in 5 Americans hasn't seen their general physician in over 5 years. And, cardiometabolic, we were again, if there's 98 million Americans that are already have prediabetes or metabolic syndrome, and there's 340 million Americans, that's an epidemic. And so cardiometabolic risk is, I believe that is the number one driver of healthcare costs in this country. And so if we can identify these patients early and then get them on a treatment plan, much cheaper to put somebody on a statin or on a GLP-1 agonist, or diet and exercise, get a gym membership and start doing that, as opposed to an unexpected hospital stay or doctor visit, wait until you have a stroke or a cardiac issue. It's not only devastating for that patient, their health, their quality of life, they miss work, people have to take care of them that are at home, but then the burden it puts on the entire healthcare system is absolutely tremendous.
And I want to build on that because you have a unique purview. You've done the big practices, really about really good access to healthcare, 20 locations. Now you're on the equipment side and really on the cutting edge. Um, and I don't want this to be, full disclosure. Topcon doesn't sponsor this podcast. I was excited to have you on. This is not necessarily a Topcon commercial, but what are you excited about from your personal perspective about what's happening in the industry? And maybe talk a little bit about what Topcon is doing as well. Because I personally, we use them in our offices too. We love them. But again, we just personally had a good experience with them. But like, tell us about what you're excited about.
I love that question. I'm excited about a lot. I had to say goodbye to my 20 locations that I built up from scratch. And I did so willingly because I am very, very excited about the future of eye care, the future of healthcare through Oculomics. Um, in general, speaking big and broad, sometimes when I give presentations, the very first slide I show is actually a picture from 1933 from the Wisconsin Historical Society. It's a picture of an eye doctor, a patient, an exam room. You see a chair, a stand. You've got some trial lenses, a chart, a keratometer, and phoropter, and all that. And that picture again was taken in the year 1933. And a lot has changed since 1933. In the minds of our patients, maybe not so much, but we know that there's breakthrough pharmaceuticals, there's new surgical techniques, we can image, to your point, down to the micron level with OCTA. So a lot has changed in over 100 years, but there's one thing that hasn't changed that I'm very, very excited about, that Oculomics is going to break these barriers, is that optometry, eye care, we continue to work in a silo. We've been working in a silo for 100 years. And that is the same for many, many practitioners overall. Interdisciplinary, we kind of work in our little silos. And so I think what Oculomics is going to do, it's going to break those silos down in a major, major way. So imagine, what are the AI models that are going to be coming out? So we know that there's 3 diabetic models that are out there right now. Those are primarily for general medicine. You've got diabetes, you don't go to the eye doctor, 30 to 60 seconds. I have a robotic camera, puts out a report. I can tell you if you have more than mild diabetic retinopathy. And if you do, I need to refer you out. Now, 90% of those referrals don't need to go to ophthalmology, which is already overburdened. But that needs to go out to your office. And that's a $200 medical referral. And so we can make this where everybody can actually get paid through this and incentivized. Unfortunately, a lot of the incentivization is through a reimbursement, but we can incentivize people along the way. Your office then can triage those patients, because we're going to raise, what does it say? The rising tide floats all boats. We screen more people. You'll have some of these people come into your office. And then when the time is right, you can then send these patients over to retina. And so they can take on the surgical cases, which may be a $2,000 case as opposed to a low level background diabetic retinopathy patient that they're already overburdened with. And we know what the wait time is to get in to see a retina specialist. It may be 3 to 6 months in some cases. So we know about the diabetes model. So there's Toku has a couple of different models. One is called CLARE for cardiovascular risk disease. It gives your 10-year risk score for atherosclerotic cardiovascular risk disease. It's a binary score based off of 50 different biomarkers and about 4 million plus retinal images. It is right now going through FDA breakthrough status. So it's not approved in the US yet. It is approved overseas. They have a My Kidney AI model, which again is an FDA breakthrough status. But then let's start thinking about Parkinson's, Alzheimer's, preeclampsia. I mean, things that you may or may not even be thinking about. And then what about PTSD through eye movements, depression, ADHD? All these things are going to be coming, and you'll be able to screen for these right at your office. And then on top of it, there's whole monitoring components to it as well. That, ODs, we don't really, we think of, hey, I'm going to see you back in 28 months when you need your next pair of eyewear. That's typically when people come back, or 15 to 18 months for contact lenses. But now I can continue to engage with you throughout the year through home monitoring, let's say for your AMD. And so that is what makes this very, very exciting for optometry. And so we being the front door now, we image these patients, we perform these tests, they're positive. And so when you think about, let's just say, CLARE or cardiovascular risk disease, what brings you in today, Ankit? Well, I'm here for an eye exam. And by the way, I saw you were on the American Heart Association's locator app saying that I can get screened for heart disease. Well, we can do that too. So part of your normal workflow, we take the retinal image, we run an AI model through it, could be CLARE, and we come up with your risk score for heart disease. And if you don't, we have the conversation, we reinforce the good behaviors that you're doing. But if you do have a high risk for that, or an elevated risk, what do we do now? Do we send you to the cardiologist? I don't know. I mean, do cardiologists want to see a level 1 patient that maybe they just need to be put on a statin? I don't know if they want to see that patient. So we have to then develop these relationships so we can triage these patients. And maybe it's a primary care physician. Maybe it's a teledoc. Maybe it's a Quest lab that we send out these patients to before we triage them. 80% of US counties are in a healthcare desert. 1 out of 3 Americans lives in a healthcare desert. These are the problems that we need to solve for, but we can't solve for it unless we scale this model. And again, going back to your building empire, we can't build an empire in a silo and without systems in place. It's an ecosystem. And so what I mean by an ecosystem is you do something really well, you've got your discipline, I've got my discipline, someone's got a discipline. But when we start to connect these disciplines, the sum of the parts become greater than the whole, right? And so this, now all of a sudden we can achieve things that we weren't able to do by working in that silo like we've been doing for the past 100 years. And so, why would I give up 20 practices and burn the ship, so to speak, like the Vikings? Because I think that we're at an inflection point in the entire industry where optometry can play just a tremendous role in the overall healthcare system with and through oculomics.
And it's interesting because the theme I'm gathering from what people are saying, what they're excited about, what I'm hearing is a consistent theme of expansion of scope, and more importantly, distribution changes, like how people come and the habits they're building to come to see the eye doctor are changing away from just glasses and contacts to primary healthcare, which is exciting.
Yeah. And so I've done a lot of consumer insight studies. I have to be careful with what I'm sharing, but generally speaking, about 15% of the people actually come to the eye doctor for a health checkup. They typically only come in because my glasses are scratched, I'm broken. My glasses are scratched, they're broken, I'm seeing blurry, or amount of contact lenses. So in effect, if I see clearly, I don't have to check yearly. And I don't know if you remember, that was the Vision Council of America's, going back, 15, 20 years ago, that was their motto or their tagline, check yearly, see clearly. The problem is I'm not going to go in unless I have a problem. Now, for those 15% of the people that are going to go in for a health check, what generally drove those people to come in and see the doctor? It was somebody had an event within the family or somebody I'm close to that I've got an emotional connection to, and so now I view an eye exam differently. So, for example, uh, my father had quadruple bypass surgery, so he had a cardiovascular event, and they recommended he goes and sees the eye doctor. Somebody, has diabetic retinopathy close to me in the family. They go see the eye doctor. Somebody had cataract surgery, and guess what? I'm the one that had to put those drops in my mom's eyes, for example. So I view the eye doctor in a much, much different light than either glasses or contact lenses, or I'm going to only go see the ophthalmologist when I have a problem, not for a preventative health check. I think we have a lot of work to do to help people understand that an eye exam is much more than a refraction. It's much more than a permission slip to spend $300, and that permission slip says -3, -1 and a quarter, axis 180. So we've got a lot of work to do. And I think Oculomics, I think partnerships with the American Diabetes Association, the American Heart Association, other advocates, consumer advocacy groups, I think the payers have to play a really big role, whether that is, I don't want to name them or call them out, not that they're doing amazing work, because they are, but the managed vision care companies, the health plans, they all must come together, and not look at this just from an actuarial point of view, but look at this from a clinical and preventative and quality of life point of view, and how that impact makes on the entire ecosystem, the entire healthcare burden.
Yeah. Well, so I'm going to shift gears a little bit. And I'm curious, you have a really cool way of thinking of the world and seeing things. Your background's really interesting. So can you share with us a story that made you who you are today? Like something could have been when you're younger, but there's a formative story for you that really resonates. Like, oh yeah, that really affected me.
First of all, I mean, many, many people that know me know how I feel about my father. My dad came here in 1959 on a student visa, 23 years old. My dad left home to study. He's a villager, from the Punjab, and he left home when he was 12 years old. My grandfather was a headmaster back in Punjab, North India, and he said to my father that the biggest gift I can give you is the gift of education. So my dad had to leave the village at 12 years old, take a train, go on the other side of the Punjab, and go live with some relatives. And he never really came back. He only came back for the summer. So he's very independent, really, since he was 12, 13 years old. Thankfully, he had some great mentors who were very kind to him. Through one of his friends, he ended up sending an application, and came to Chicago. That's where he landed. Worked a couple, 2, 3 jobs. And there was a wonderful story that he shared with me. And this is, might take a little bit of time. I'll just tell you the short form version of it. But he went to apply for a job as a student, and he went into the office, and the gentleman said, "Yeah, you have the job, but you have to leave your hat at the door." And my dad said, "This is not a hat, it's a turban." And he explained, you can imagine back in 59, the exposure just really wasn't there. And he said, "Well, please come back in when you're ready to remove your hat at the door." And so my dad couldn't find a job. He's a struggling student. I saw pictures of him, and he's like this skinny. And then he came back a couple of weeks later, still desperate for a job. And he said, "Sir, please hire me." And he said, "Sir, I can't do that. You have to leave your hat at the door." And my dad said, "I just can't do that." And so what ended up happening was my dad ended up getting a job at University of Chicago and started working for a gentleman, doing math and stats and things like that. Well, that person ended up winning the Nobel Prize. And so, yeah. And so, when we bump into obstacles, we can easily have our ups and downs, and we can quit, but to be able to persist despite obstacles, have that relentless pursuit of excellence, and not sacrifice our values, we certainly have to be flexible and be realistic. but what's important to you, and what defines you as a person, you can't let those things go. And so, my dad has probably been the biggest mentor for me in my entire life, and he continues to do so. But that would probably be the one story that I would tell you that has really changed my life, hearing that.
Thank you for sharing that. That's awesome.
Thank you.
It's it's amazing hearing these stories from folks. It's always curious. I love that. And I think uh, I'm curious because of you've had such good mentorship, good relationships with your people around you. Is there anything that you'd give yourself advice if you were starting off over again outside of OD school? Like what would you tell your younger self?
Well, growing up, we were kind of trained to be risk averse. Like, don't make too much noise, kind of stay within your lane, put your head down, grind it out, and all those things of, get you through optometry school and get you the grades and help you make good decisions. And I think that those are very, very important. The cultural values that we have are extremely important. And I would say, don't let those values limit you. Explore those values even further and set your sights and build skills that get outside of your comfort zone. I know that sounds cliche-ish, and I think that would be very, very valuable. In some cases, I felt like I didn't bet on myself early enough. I think a lot of my leadership career probably could have started a little bit earlier. I could have switched roles earlier. I wasn't sure if I'd be successful in the next role. I had a little bit of imposter syndrome from time to time, but lo and behold, when you get into a role and it's an ambiguous situation, you know, you don't lose who you are because you change roles. You're going to figure it out, and you just have to trust yourself. And to your point, reach out, and find individuals that have already been there and done that, and get their advice. There's a great book called Tribal Leadership. I'm sure you've read that book already, and it talks about why culture works or how people can be successful. And one of the stories that are in there is about when people get released from prison, how what makes you successful as you enter civilian life. And they talk about having this triad of mentors, and they could be completely different. They're not just the same three and they all group together. But I've got, more than a triad of mentors. One of the folks that I talk to on a regular basis now is somebody who really is a legend in eye care, and that's Dean Butler, the founder of LensCrafters and Vision Express and many businesses across the world. Wally Lovejoy is another one who I reported to. He's an economist, an attorney. I regularly connect with Wally. And then there's others, that you may or may not know, but those two individuals in particular have played a tremendous role in my career. And I continue to just, sometimes just calling and asking about their family. And sometimes is, hey, am I playing this right? And, where do you see the future at? But I think mentorship is extremely important, and getting at least three people within your circle that you can rely on from time to time.
Yeah, I like that. Thank you so much. This is action packed, man. I feel like we could have went for like hours on this, just diving into your experience. So if folks want to reach out to you, where can they find you?
Well, you can follow me on LinkedIn. That's the easy way to do it. And if you send me a message, I'm happy to respond to it. Hansra at topcon.com, Rhansra at topcon.com. And you can send me an email there as well.
Perfect. We'll put those in the show notes, folks. Well, Rupe, thank you again for being a guest on the podcast.
No, you're an amazing host, and I hope to be back soon.
Absolutely. And I want to share a quick takeaway. I'm trying to synthesize your experiences. So I heard people, purpose, and then process in that order, performance in that order. But more importantly, the purpose seems like there's an opportunity to connect the purpose with the way the industry is changing with distribution and access to care. So maybe having doctors sort of think through that a little bit more of like, really, is your purpose just seeing the patient in front of you, or is it really thinking about serving the community at a large, in a different way and looking at other ways to do that?
That's absolutely right. And thank you again for clarifying all the thoughts that I have in my head. You did so nicely.
Well, it was really cool listening and hearing that and putting those together. So thank you for sharing.
Thank
And
you. Yeah. Hey, I'm going to be in Atlanta soon. I hope we get a chance to connect.
Oh, we will. We will for sure. And thank you, audience, for listening. If you learned something, laugh, please share the podcast and make sure to subscribe so you don't miss an episode. And if you see the link for a meeting, please, if you sign up for a meeting, I'll send you a free copy of my book. And again, thank you again, Rupe, for being on the podcast. This has been another exciting episode of Optometrists Building Empires. We'll see you next time.
Bye-bye.
That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.